Which stem cell transplant is best for lymphoma patients? Deciding on the right stem cell transplant for lymphoma can feel overwhelming, but understanding the options helps clarify the choices. For non-Hodgkin lymphoma patients, the decision between autologous and allogeneic transplants depends on many factors like the lymphoma type, how advanced it is, the patient's overall health, and previous treatments. There isn't a one-size-fits-all answer. Instead, doctors personalize the approach based on each individual's situation. An autologous stem cell transplant uses the patient's own stem cells. These cells are collected before high-dose chemotherapy, which aims to kill off cancer cells. After chemotherapy, the stem cells are reinfused to help rebuild the bone marrow. This type is often used for patients whose lymphoma has responded to initial treatment or has relapsed but is still sensitive to therapy. It's generally considered safer because there's less risk of immune rejection, since the cells come from the patient. However, it doesn't have the immune system's graft versus lymphoma effect, which means it doesn't actively attack remaining lymphoma cells. On the other hand, an allogeneic stem cell transplant involves stem cells from a donor, usually a sibling or a matched unrelated donor. This transplant can be more effective in certain high-risk or relapsed cases because the donor's immune cells can recognize and attack lymphoma cells, providing what's called a graft versus lymphoma effect. This immune response can potentially lead to a longer-lasting remission. But it also comes with higher risks, such as graft versus host disease, where the donor's immune cells attack healthy tissues, and other immune-related complications. Managing these risks requires careful use of immunosuppressive drugs. There's also a third option called a syngeneic transplant, which uses stem cells from an identical twin. This avoids graft versus host disease but doesn't have the graft versus lymphoma effect, so it might be less effective at preventing relapse. Recent trends show that autologous transplants are used less often for certain lymphomas like diffuse large B-cell lymphoma because newer therapies are available. Treatments like CAR T-cell therapy are increasingly used for relapsed or refractory cases and sometimes replace the need for a transplant. These advances are changing how doctors approach treatment, often combining stem cell transplants with other immunotherapies. In summary, autologous transplants are often preferred for patients who are in remission after initial therapy and need consolidation, thanks to their lower risk profile. Allogeneic transplants might be considered for patients with high-risk, relapsed, or refractory lymphoma because of their potential for a cure through immune effects, despite higher risks. The choice depends on the specific lymphoma subtype, the patient's health, prior treatments, and donor availability. Because these decisions are complex, they should always be made with a team of specialized hematologists and oncologists who can tailor the approach to each patient's unique circumstances. It's also important to remember that emerging therapies like CAR T-cell treatments are reshaping the landscape, sometimes reducing the need for transplants altogether. Always consult your healthcare provider to understand the best options for your individual case, as medical decisions should be personalized and based on the latest evidence.